Welcome to the Fascia-Informed Therapist, the essential podcast for occupational therapy professionals looking to deepen their understanding of fascia's pivotal role in therapy and health. I'm your host, Amy Mayer, an experienced occupational therapist, practice owner, and dedicated educator. Here we'll dive into the fascinating world of fascia, exploring its significance in the human body and its critical influence on occupational therapy practice. Each episode will bring you cutting-edge insights, expert interviews, and practical strategies to help you confidently integrate the science of fascia into your therapeutic approach. Whether you're a seasoned practitioner or just starting out, our goal is to equip you with high-quality, evidence-based, and fascia-informed continuing education opportunities that will enhance your skills and benefit your clients. So join us as we unravel the complexities of fascia and transform the way you practice occupational therapy. All health and wellness practitioners are welcome. Let's learn, grow, and evolve together. Hi, I'm Amy, and this is another edition of the Fascia-Informed Therapist. And today we're going to talk about scars. And I know there's going to be many of you out there that know a whole lot more than I know about this topic, who are probably working with people every single day who have scars and need help with them, both brand new scars and maybe old scars. So I'm being vulnerable, and we'll just see how this goes, okay? The reason that I chose to talk about this is because I just read a fabulous book out of Edinburgh, England, I believe, and anyway, it's incredible. It's incredible. We have so much to learn about fascia, and this book was particularly about scars. It's called Scars, Adhesions, and the Biointegral Body, Science Assessment and Treatment. And the editors are Jan Trewartha and Sharon Wheeler. And the reason I chose to read this book, because sometimes you see stuff out there and it's just like, that sounds kind of gimmicky, that sounds really, but the foreword is by one of the forewords is by Robert Schleip, and he is one of the most forward-thinking fascial researchers out there, has really done a lot to bring the science into the limelight, into a place where we can find it, and has edited humongous science books about fascia. And anyway, so that made me want to read this book. Also, there's a chapter in here by John Sharkey, who I've talked about many times on this podcast, because I got to see actually both those gentlemen speak at the Fascia Research Congress, and anything that they produce, I will likely read. So, incredible book, and there's a link to it. I'm going to put a link to it on my website if you want to check it out. If you work with scars, I highly, highly recommend it. New scars or old scars, because there's amazing pieces in here that even for new scars you can use to educate your clients on what to do, what not to do, and how to care for the scar in the future, or what to do if they have problems down the road, or what to look for. So anyway, we'll talk about that, but let's go backwards in time a little bit and talk about what is standard of care out there. And it was really interesting because I took some time to read a couple books. There are sections on scars, and to jump on YouTube and see if I could find some recent videos of PTs and OTs or anybody related to us, degree-wise, to what were they teaching? What were they teaching about how to do scar massage? And were they teaching other therapists, or were they teaching the patient, the client? And the ones I found and watched were directed toward the client. But what they were basically teaching was pretty much the same stuff that I learned in OT school in the early 90s. Basic scar massage, the little circular movements, pulling the scar away once it's healed, of course, and trying to create the mobility of the scar, that the skin slides and it's not sticking to the tissues below. Once the scar is healed, more cross-friction massage. And then some talked about the compression or silicone gel sheets or the little putty that you blend the two different catalysts together, or the putty with the catalyst, and then you push it into the scar, and then it creates some pressure over the scar. Anyway, I remember using all that stuff in my traditional practice, and that's pretty much still what's being taught today. Some people might be taught desensitization or using different physical agent modalities with scars, maybe some kinesiotaping, moisturizing. Some of the videos said do not use any oil or cream, and some said to. So there's just a lot of variance what's out there as well. And some other beliefs out there too, in very recent books, that there's a time frame, there's a time limit on when you can affect a scar. And that's sort of that is the belief, that's been the belief, and that we always operate from the best information that we have, right? So I'm not trying to diss anyone or anything in my sharing of this information, but I will diss you if you're not willing to learn, because if you're going to be in the health professions, you've got to continue learning. You've got to. It's an ethical obligation. I think when I was at Creighton, the professionalism ceremony and the oath of the occupational therapist, and you have an obligation to do the best you can for your patients, and that includes continuing to learn and giving them the best of what's out there. Now, given that, I will also, this is a little tangent, sorry, but I recognize too that we don't have time to do that. I mean, when I was a full-time practitioner, I was also raising 2 kids and had a husband, and when was I going to read journals? When was that going to happen? I had a productivity standard to meet. I had lots to do. So you learn from your colleagues, and you get bits and pieces in where you can. And I would say that just knowing that is why when I try to teach something in my courses, it is practical. You don't get a whole lot. You get the science you need to know, and then the practical application. And I really try super hard to make them super efficient and not ramble, kind of like I am right now, I guess. So let's talk about, let's see, scar maturation. We just talked about that. Some people do believe that you can affect it 2 years or, excuse me, even beyond. However, in this amazing book, they teach that and give case studies of affecting scars that are many, many, many years old, even decades old. And I've tried this technique on a few clients now, and I would definitely say that is absolutely true. Now, let's talk about scars, because I'm sure there's some of you out there that really don't maybe work with a lot of fresh scars, or mostly see old scars, or really don't pay maybe much attention to scars at all. So when the body experiences an open, whether that is a surgical opening or a wound from an accident, all the body wants to do is close that barrier. And of course it rushes the inflammation and everything in there to try to clean out anything that might have possibly come in there during that time frame of the skin being open. But all the body wants to do is close it. And it doesn't matter if it's pretty or not. It just needs to be closed because an open skin is life-threatening. You've heard me many times talk about the fibroblasts in the fascia, cell within the fascia. And the fibroblasts rush to the area and start creating collagen. And the collagen gets laid down in a very disorganized fascia, just in an effort to start creating a boundary. But some of the fibroblasts are then converted into what are called myofibroblasts. So myo means muscle. They're not turned into muscle, but what they are turned into, or what they do, is they act as mini winches. So they're just like pulling. The fibroblasts are laying down the collagen, just getting it in there, and then the myofibroblasts start to pull everything together. But what we have to remember is that the fascia is not just right underneath the skin, and likely the cut that was made, especially in a surgical incision, is deep. And so this process of the layering of disorganized collagen and the little myofibroblasts that are winching it all tight to hold everything together is happening layers below the skin. In the book, they also describe that as, or compare it to an iceberg. That, we only see the tip of the iceberg, and there's a whole heck of a lot more going on beneath it. Because you have to imagine that disorganized collagen and the myofibroblasts are grabbing onto whatever they can in order to make sure this wound stays closed. Additionally, John Sharkey talks about in his chapter, remember he's a clinical anatomist, so he's dissecting all the time and teaching others about what's going on inside the body. And he talks about how you can have very similar scars underneath the skin, but yet there's been no change in the skin itself. So you can have similar kinds of injuries. And I would say I recently had a client that exactly that happened. She had no damage to her skin, but she's got a lot going on underneath the skin because she had a cramp in her calf so intense that she tore a muscle. And result had some bleeding in there, and now some of that blood is stuck. They drained it, but they couldn't get it all out. And so she's having some symptoms around that, but we won't dive down that rabbit hole. But you can have that same sort of disorganized winching of the fascia in order to protect anything. It doesn't have to have a visible sign on the skin. I was trying to explain to this client how barriers are created, or trying to help her visualize how the tension or the protection can result in the scarring in the fascia, or the tension in the fascia. So I was trying to give her this visual, and how I described it, which really seemed to be helpful for her, was if you imagine layers and layers and layers and layers of fishnet stockings. They have that kind of diamond shape when you pull them apart, but then when you relax them, it doesn't look less necessarily like there's any holes in there. It all comes back together. Okay, so there's always some level of gentle tension in the fascia, even when you're at rest, right? So imagine those layers and layers and layers and layers and layers of stockings, but then you also have to, because fascia is really not in layers, but that's easier to wrap our brains around. And then you also have to imagine that there's little pieces of thread or elastic connecting all those layers together, so that if you pulled them apart vertically, you'd see all the connections between all the layers to the other layers in many, many, many spots, right? As many spots as there are little diamond-shaped connections, right? So imagine all those layers, they're laying on top of each other, but they're connected. And then imagine that the layers are just doused in liquid, maybe some sort of liquid that has some viscosity to it, like guess we'll use baby oil. Baby oil. And so all the layers can slide and glide against each other in a frictionless way. But then imagine, so I asked her, I'm like, you with me? Can you visualize that? And she's like, yep, got it. And then I said, imagine taking your hand, spreading your fingers apart, reaching down through those layers and layers and layers of material and squeezing it together. And it doesn't even have to be a very tight squeeze, but your fingers are moving through the different holes of the material, the fishnet stocking holes, layers and layers and layers, and you're pulling them together. Even just pull them together very gently with your fingers. And I said, can you imagine doing that? And she's like, yeah, of course. And some of that liquid is squishing out, but what happens when you go to the end of the material and you try to pull on it? Can you see that pull on the opposite end of those layers? And she's like, no, I can't. It doesn't pull through. If we pulled it without grabbing the material, we would see that pull being translated all the way through those layers and layers. But if we just reach our fingers down maybe and go halfway through the layers, and then we do that same pull, we can see probably some of that being translated underneath where our hand is, but not where our hand is, because we are creating a restriction in the fascia. And we're also creating a restriction where the fluids can't flow either, maybe slightly or maybe a lot. So that really seemed to work for her, and that made it clear to her why whatever restriction was going on in there needed to come out. Now, this book has many, many chapters on the science behind what is going on with scarring from the perspective of the fascia. I think I wore out a highlighter with this book, even though it's really not that big of a book. There's actually 161 pages. But it's so interesting. I would highly encourage you to read it again if you work with scars, or maybe if you don't, if you work with fascia. Understanding again the science is important for you in making decisions about what you're going to do, and also educating your clients. And I'm just going to throw this in here too about the years later thing, because I talked to a client recently who was telling me about how she had a cesarean section, and she also had another birth where she had an episiotomy. So she was explaining to me that she's really never had any problems related to those scars that she was aware of until recently, and she is decades past having babies. That she had some thickening of the episiotomy scar that was causing her functional problems in her daily activities. So if a scar can be changed, if a scar can change itself for the negative, for the worse, to cause problems, get tighter, why can't we influence it in the opposite direction? Now, I'm sure some people will say that doesn't make sense, and maybe it doesn't, but scars can change years later. And I believe now that we can definitely influence them for the positive years later as well. So let me talk about this book in terms of what they're suggesting. And they have a whole chapter on the unreasonable effectiveness of light touch. Because I would say what I'm trained in and what I've seen work many times is you push to resistance into the body, and then you glide the skin to resistance, and you wait, right? And that is what seems to work with the myofascial technique that I use. Now, this is very different, and they are saying there's the different phases of how the fascia is shaped. There's the crimped phase, there's a straightening phase, and there's a microfailure phase where you are actually pulling something apart. You're breaking something. And then there's a fourth phase where you're rupturing. You're really aggressive and you're rupturing things. They are suggesting you never need to go past phase 2 to affect a scar. So I know there's therapists out there that are still teaching pretty aggressive techniques. And I know that because I have clients who come in and tell me about their experiences in life and other therapies. And there's all kinds of practitioners out there. So some that still believe you have to have pain to gain. And I am totally past that. So they're suggesting that our job is not to try and break adhesions that are making this scar stick to things. Our job is rather to reintegrate this tissue that's kind of isolated itself into this very disorganized, tight, scarred area. Again, whether that is right underneath or it's somewhere else in the body, but let's just focus on the scars that we can see, because that's probably the easiest to deal with. So again, we're trying to reintegrate this tissue into the fascia around it in order to allow it to be part of the support system for the body. Because there's another part in the book that's really, it's kind of of course, but it really helped me visualize how, if you imagine you're going to reach your arm out, but yet maybe you've got a scar from a surgery in your chest or breast. If there's a scar there that has all this disorganized tight tissue, tight fascia, then the strain of pull or the line of motion has to go around that, and that's going to create a more unnatural way of supporting that arm out in space to do whatever it is you're going to do. So if we can reintegrate that back into that a normal strain line, or a strain energy they call it, then that's going to be more functional for the body. In the book, they talk about the fibroblasts as being motivated or dormant. And the motivated ones, the way I interpret this, and this is a book I feel like I need to read a couple times. I've already read it, highlighted it, went back and reread my highlights, and I feel like I need to, there's just so much. I want to read it again. There's motivated and there's dormant fibroblasts. And what it sounds like to me is that the motivated ones are the ones that are in that area still hanging on, trying to protect. And then we're trying to stimulate the dormant ones that are going to come in and help to reorganize. And they don't necessarily say this in the book, but this is my interpretation based on lots of other resources that I've read, is we need to make that space feel safe. And a lot of the scar techniques that I've learned in the past is you're pulling the scar, moving it around, you're putting your fingers on it, and you're pulling it away from where it is into all directions in order to make sure it moves. So imagine with me that if you're doing that, those disorganized, highly motivated fibroblasts are going, whoa, 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 what's happening here? Let's hang on. Something's happening to this problem area. Or if we take a lighter approach and start motivating those dormant fibroblasts that are going to come in and reorganize, that makes sense to me because that lighter touch is going to help the fascia feel safe. So a lot of their technique actually moves toward the scar. You're sort of pinning down the skin with one hand about a few inches away from the scar, and then you're stroking towards the scar. Now, I'm not going to try and teach you the technique over a podcast, but there's a lot of light stroking and then some stroking that is a little more firm, so you're really feeling the density and where they're feel like little, like tighter areas, little knots, and you're sort of stroking those out, but always toward the scar. And then pushing the skin if you have one hand on either side, you're kind of pushing the skin together. And then you might push the skin together and sort of do like a kitty cat does, like a little massage that the kitty cat does, where how making biscuits is what we always called it. But you're not finding resistance. You're just creating this mobility. And then there's another technique that follows that, where you sort of find a spot of resistance on the scar and you just gently push straight down. And then finally, there's what she calls integration, where you put your hands distant from the scar on either side. And my interpretation of it is it's a very, very light pulling apart so that it starts to feel that strain line. You might choose a strain line, like if it's on the tummy, you might put one hand on the leg and one hand under the breast and just gently distract that area so that there's the fibroblasts can start going, okay, there's the strain line, and reorganize themselves into that line rather than this disorganized jumble of collagen. And I'm sure for some people that's going to sound really hokey, but I've actually used this technique with several clients now. And because the book provides, I'm not sure if I said this, but the book provides a QR code that you can follow, and someone shows you they show you the techniques and give you examples of what it looks like. Now, I have lots of questions. I would love to go to one of their workshops if I can get over to England sometime. Like some of their case studies show that they did these techniques for many sessions. Some of them talk about hour-and-a-half sessions. Some of them talk about integrating other techniques into the sessions. So I don't think there's a protocol, but I would love to know a little more about their experience and where they've experienced the most change. But I can tell you that I've used it on a client with a 3-year-old chest open heart surgery scar, who she felt like it was continually pulling her forward and pulling her shoulders together. And I did 3 days in a row of very light work on that scar. And even 3 weeks later, she was still saying that she felt more open. I used the technique on a client with a 1-year-old injury from a car accident where she had several ribs broken, and went in and put different little plates and things in there to hold things together. So she's got a lot of scars, and she feels a lot of pulling forward on that side. So the shoulder tends to want to come forward and down. And she reported a very similar outcome and asked for that light touch again at her next visit. And I anticipate the next time she comes, and she loves the technique that I typically use and really credits that. And she gets a lot of credit too, because she does an amazing amount of wonderful variety of movement to support her healing. And she was in a pretty serious accident. Anyway, she has felt like the myofascial technique that I typically use has been incredible and very helpful for her, and has been a big part of her healing. But now she's asking for this lighter touch because she felt and experienced the change around her scars. Very interesting. And then the next client that I'll mention is the one I think I may have talked about her earlier. She has 2 injuries on her leg, and one of them is about a year old, and the other is only a couple months old, and has made huge difference with her as well. After I did that, this lighter approach toward the scar on her chronic hip pain was gone. And I know that lots and lots of different things can happen, and people can other things can happen in their lives. Inflammation went down, they went on vacation, whatever can happen and improve their experience of pain. But she feels like she didn't do anything different, and it worked so well for her after one treatment that she also asked for it again. So there's something to this. There is absolutely something to this. And I can't wait for even more information to come out to help us understand the best possible approach to working with scars. And finally, before we wrap, I'm going to tell one more story with our dear Caitlin. And I have her permission to tell this. So Caitlin was a premature baby. Very, very small. Very, very small. And she had a tube that went through her belly button that she had in there for quite some time. And Caitlin is 26 years old now. And she has had a very, very sensitive belly button. So sensitive that if someone touches it, she might throw up. And she says it's not really painful, it's just this really irritating sensation. And she even has trouble touching her own belly button. And she really has to kind of work herself up if she's going to let somebody work on it. And I have worked on her stomach area in the past using the myofascial techniques, and she's felt like, oh yeah, it was kind of helpful, but it, nothing really stuck very much. So I asked her if I could try this scar technique on her belly button area, and she was all about it. Now, what I also didn't say, okay, so if somebody touches it, it really makes her nauseous, but she also can't tolerate like a waistband of pants or underpants on her belly button. They either have to be above or below. So that's another indicator of how sensitive her little tummy is. So we tried the technique, and I did one session of all the techniques, the light stroking, the slightly heavier stroking in the direction of the belly button. and the pushing together with the mobilization, and then what the book calls the down the rabbit hole. So you find the one point of the scar, you have a finger or two on it, you're pressing straight down. And so she let me go right into the belly button, and you just sort of light pressure on it, and you follow, similar to traditional myofascial technique that I use, you just follow the release. You follow the release. And she said that there was a huge change in her experience with the scar, and that she could now tolerate her pants over her belly button, and she could better tolerate touching around that area. And that has lasted several weeks. And the last time I asked her about it, she said, yes, it's starting to get sensitive again. But if you can make that kind of change in one treatment, I think we worked for 20 to 25 minutes is all. That is not very long. And so imagine if we did that maybe 3 weeks in a row, what would that look like? And we need to do that. We have another appointment lined up where we're going to do that, and maybe I'll be able to report back on that sometime. But anyway, what I really want to accomplish with this particular podcast is that we have to be open-minded, and we have to be willing to continue to learn and grow in our understanding, to pay attention to what's coming out and check our beliefs and learn new and try and experiment. So thank you so much for listening. I really appreciate everyone who has supported us, and I will put a link to the book, or I'll put the name of the book so that you can check it out if you choose to. Thanks. Thank you for tuning in to the Fascia-Informed Therapist. It's been a pleasure sharing insights and strategies to help you integrate fascia science into your practice. I'm Amy Mayer, and I hope today's episode has inspired you to explore further and take your therapeutic skills to the next level. Remember, we're committed to creating and providing top-notch, evidence-based, fascia-informed continuing education that empowers you as an occupational therapy practitioner. Stay connected with us for more enriching content, and don't forget to check out our online courses to deepen your expertise. Until next time, keep expanding your knowledge, refining your skills, and confidently applying the science of fascia to your practice. Here's to advancing together in health and wellness.